Yo, 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 what's poppin', everyone? This is your boy, DezDaKing, and we back again with another episode of King Talk TV podcast. This is episode number 49, so we're getting up there. We're getting up there. In a few moments, I'm going to bring on a special guest, my friend Jay, owner of Work Time Athletics. We are going to discuss. We're going to discuss medical training, fitness, physical therapy, and we're going to touch a little bit on pharmaceutical companies. So my man is knowledgeable. He has a PhD in all this stuff. So we're going to talk about that, and it's going to be a great show. So if you're watching this live on YouTube, sorry, if you're watching this live on Instagram, comment below your name, where you're from, so I can shout you out throughout the show. Please don't be afraid to ask questions and dialogue with us. That'd be great. If you're watching this on YouTube, please consider giving this a like, subscribing, comment below your thoughts, and let me know what you think about this show today. So without further ado, I'm going to bring him on, and it's going to be a great show. What's going on,
Hey,
man?
nothing much. Let me see if I can get my camera straight up here. There we go.
Yeah,
How you doing, brother?
I'm doing well, man. How are
I'm
you?
doing real good. Thank you for asking.
Man, how was church today?
How was church, you said?
Yeah.
It was fantastic, man. As always, the message came across, was just on time, had a place in my life, had a place in current things happening, and it's applicable, man. It's like they say, the Bible is the basic instruction for living every day.
Right. Right, man. Right. Well, I'm glad you had a good time there, bro. And I also want to say thank you for taking time out your day, because I know you are a busy man with all the things that you do, which we're going to talk about today. But thank you for taking time out your day to have a discussion with me and provide me with some good content for my channel. And not going to hold you too long, but I just want to just jump into it, man. Could you just say a little bit about yourself, just a little bit about your background, what you do, your practice, and just a little bit about yourself?
Okay. Thanks for having me. I appreciate it. So again, my name is Jay Jackson, retired military guy, medical community in the military, combat medic, and a nurse. Run several floors in the hospitals that I've been at, the duty stations I've been at. So my last deployment was pretty rough. We saw a lot of my unit got hit pretty hard. Had a lot of casualties in the unit, and that really bothered me. So I didn't want to stay in that part of medicine anymore. Moved over to sports medicine. I was also the World Class Athlete Program, which is the Army Olympic program's strength and conditioning coach, one of their most successful years. We sent 7 athletes to the Olympics and 3 coaches in 2012. And I was one of the very few changes in the program that helped do that, bring that program to that type of success. We also sent the entire wrestling team, except one person, to Olympic trials, which hadn't really been done before either. So coming out of there, retiring from the military, I decided I wanted to continue to pursue medicine. I went into sports medicine, and so currently almost got my doctorate. I'm almost there. I've got less than a year at the University of Idaho right now. I did finish my undergrad and my master's degree at CSU Pueblo in sports medicine. So I do athletic training. I work with the high schools here. I do have a clinic inside the gym. But I'm a scientist. I'm a medical scientist. I dig deep into research and make sure that what we're getting and what I apply and provide to my patients is legitimate, it's prevalent, and it's effective. So I don't really believe in a lot of the ways that medicine goes today. I don't think it's geared toward the best possible scenario for the patient. And so I practice my own way of doing things, and we have a very good success rate with that.
That is awesome, man. I wish I knew more people like you, more people who don't just follow I guess, the traditional medical standard. Now, I'm not saying there's anything wrong with tradition. Tradition is good, but sometimes certain practices need to be evaluated and dissected. And if there are areas where we can improve in, we should improve in those areas, especially at the expense of the patient. We want the patient to have the best experience possible, and not just overcharge them for no reason other than to make money.
Yeah.
So,
Yeah.
so, so Jay, talk more about medicine. Talk more. Well, actually, let's get into athletic training. What are some issues that you see the way that athletes train these days, and what ways do you think it can improve, in your opinion?
So in the regards to how an athlete trains to physically prepare for competition, I still see a lot of spillover from the past. In the past was the old antics of work hard, work harder to get better results, right? And in today's athlete, uh, starting probably around mid '90s, and you can't quote me on that. I'm not sure, but that's when I began to understand and pay some attention. Science became a big part of training, and so it's not just the physical training, it's the how, the when, the why, the timing of nutrition, the type of nutrition. Science became a big part of training. And so the old adage of work hard, if you train hard here, then train harder to be better, it has some truth to it, but that's not it. There's not enough understanding of all of the aspects of science that are involved in an athlete training for competition, and then putting that science into the training at the right time, in the right place of training, to produce the best results in an athlete. I think that education and understanding is missing in the majority of training today. Um, and, and and I think that's what's wrong with it. Now, when you get into D1 college level, sure, it's there because they have strength and conditioning specialists, strength and conditioning coaches that are training the athletes. They have athletic trainers. Fortunately, here in Colorado Springs, we have one high school, which is Mesa Ridge. That's the high school I work for. They have an athletic training and a strength and conditioning coach who work together. And we have the data that suggests that because they work together and because they're programming athletes together, we have a reduction in injuries. We have successful athletes. And I'm telling you, y'all better watch out for Mesa Ridge. They're average football players in high school squatting 500 pounds, benching
Wow.
over front squatting 225. That's the effect you have from a solid strength and conditioning specialist and an athletic trainer that put their science degrees together and apply that to an athlete. That's what you get. High school kids that are pushing NFL numbers, 4.3s and 4.40s. That's what you get when you put it together.
Wow, that is
Yeah.
amazing. It makes me wonder why everyone isn't caught on to that. It seems like such a simple thing. We strength and conditioning, the science, the data, and just implementing all that together will obviously, to me, produce the best results in these young kids. But obviously, as well, most schools are not on that. Most schools are not doing that with their
Yeah.
athletes. Why do you think that is? And is it a money issue? Is it just ignorance? Like, or what is it?
No, it's and I think there's a very hard truth to this, but it's a money issue. I've gone to the high schools, I've gone to the administration boards and said, hey, this is what you need to do, and you need these kind of people. But they don't want to. The schools don't want to pay. They don't want to have an additional expenditure of money, right? In athletic training, the degree in 2022 went to an entry level of a master's degree. The strength conditioning coach is still an entry level of a bachelor's degree, but believe me, those bachelors could very well be master's degree, a master's degree education. They know the body training and conditioning, and you have to pay for that. And the school doesn't want to. The schools don't want to. They maybe want to pay for one or pay partially for one, but paying them both is a really, really tough thing for them to do, even though the schools make the money. Go look at what the school makes in an average high school football game. It's quite a bit of money. But again, I think it solely comes down to a money issue with the schools.
And it's like you said, it's not like they don't have the money. They have the money
They have the money
to get it, but they don't have the money.
They do. They do. They don't want to admit they have the money, but like I said, if you just take the breadwinning sport in schools is football, and you take a football game at a home football game at a school stadium and look at how much they make. It's an easy to find fact, but the number one state paid employee in almost every state is the college football coach.
Wow.
So you mean to tell me that they don't have money? And I mean, of all the the number one state employee, the number one paid state employee, the highest paid is the D1 football coach. Really? And the schools don't have the money to take care of the athletes that provide that funding? It's tough.
Now, you said D1. Did you mean high school or did you mean Division I college?
I mean college as far as the highest paid. As the highest. So,
okay.
But that's just high school's a step down. No, they're not paid as much as college, but those coaches get paid as well. And their program, the football programs is the single most funded program in high school for sports. Football's the biggest. So they got
right. It definitely brings in the most money. But the even the high schoolers, even at the high school level, they have enough to do it. They just choose not to do it, which is unfortunate. That's unfortunate. But man, I'm just thinking about a 14-year-old front squatting 300 pounds. Man, that's crazy.
Yeah, I think their average is 225. I think they got every kid on that team right now squatting 500 but 2. And one of them's close, and then the other one's a little bit behind, but he's a smaller athlete. And here's the crazy part. They're only losing 3 seniors after this year. So kids, right, they're going to be there next year. I'm like, man, these kids, it's good that I'm going to be on the sideline because these kids probably going to hurt people.
They're going to kill you. They're going to kill you, bro.
These are evolution of the species. These kids are monsters. Man. I love it. It's great.
That's awesome to hear, man. I'm going to have to come and check y'all out. Check y'all out one day.
Please do.
That'd be fun.
Their strength coach,
that'd be fun.
Coach Marthaler, and their head athletic trainer is Brianna Sage. So they're a fantastic team, and they're the only city I know in those school in the city that has that team like that, and it's showing. It's very much showing.
Nice, man. That's cool, bro. We're gonna keep up with that. Yeah. So I got a few more things I wanted to talk to you. Can you discuss the common misconceptions when it comes to athletic training, strength, and conditioning? Like, what is some things that people you work with, or just in your experience, that people sort of get wrong about training themselves and strengthening their bodies?
Okay. And you said athletic training and strength and conditioning, and I want to highlight those 2 separate fields. Strength and conditioning does train athletes to strengthen and condition athletes for a sport. An athletic trainer provides medical support, right? We are the health of the team. There's 2 different things. I do hold both, but there are 2 different career fields, right? So the athletic trainer, DeMar Hamlin, when DeMar Hamlin went down, an athletic trainer was out there doing CPR. That's the healthcare person of the team. That's the on the field, sideline, side court, whatever sport. That's the healthcare manager and caretaker for the team. That's athletic training. Strength conditioning, we train athletes to participate in sport and better their physical performance through training. So which one would you like me to talk about?
I want you to talk about both of those, man. If you can.
Let's get it. So the strength and conditioning, you said, what are some of the misconceptions or mistrainings?
Yeah. So there's a lot of bro science that goes around the internet,
sure.
About and everybody and their mom has a video on strength and conditioning and things like that. So just in your experience, Jay, what is something? What is one thing that stands out to you that okay, this is a whole complete misconception. This is a myth. This particular exercise or this concept is not applicable across the board or at all in this field.
I think the just lift weights, get in the gym and lift weights. You know, that's very poor. There's a structure and science behind weightlifting. It's actually a whole application, right? If I'm really looking to better an athlete, I have several ways that I can approach it. The National Strength and Conditioning Association really likes periodization, like it's part of how they teach you to do it. You periodize a strength. So I'm going to put an athlete in a strengthening phase, and that's going to go what we call a micro or a macro cycle. Macro being a longer cycle, about 12 weeks, and micro being something smaller and shorter than that, right? And I'm going to put that athlete in a strength phase for that one. And then I'm going to graduate the strength phase based on science for a continual progression. I want to put the body in what we call progressive overload and constantly push the body to the limit to cause the body to adapt to the limits that I'm pushing it to, making the body better, stronger, right? And so after that, maybe I'd condition the body differently after strength. Maybe we would do speed, or maybe we would do power following strength, you know. And then as I'm looking at the season coming to, or a specific competition, now I look to peak that athlete. I look to take all of those things that I train that athlete in and make that the pinnacle, make his performance the top that it can be for all that he has in his strength, in his conditioning, in his speed, in his agility. So just go in the gym and lift weights is not it. It's definitely not. It's a very, very commonly done misconception. Just do this. Well, you need to run faster, just squat. Well, no, the hamstrings are a humongous part. And if you just squat, you're probably going to blow out some hamstrings during your running season. So, you know.
And that makes perfect sense too. Yeah, just lifting weights, thinking that's going to just carry over into everything. That it doesn't even seem like that would work, even if you had no experience in any type of strengthening and conditioning. You would think that okay, just lifting weights. If I just bench press, that's going to help me out with jiu-jitsu or whatever. There's specific exercises that apply to certain sports. Right, there's specific things that you have to do or should do that prepare you for that prepares you for a specific activity.
Yeah.
So that makes a lot of sense there. That makes a lot of sense. Could you elaborate more on? Okay, so forgive my ignorance here. I was saying strength and conditioning, and what was athletic? Did I say athletic training?
Yeah.
I was saying they were the same, but they're not the same. So now, if you don't mind discussing the other portion of that, which would be athletic training. I think that's what I said. If you can talk about what misconceptions or things that are going wrong in that field in your experience.
So the athletic trainer is often in just discussion thought to be the training person of the athlete. That's the number one. People think that we train the athletes. And like I said before, the athletic trainer is the healthcare person of the team, the healthcare provider, the immediate healthcare provider. We have a role in injury prevention, equipment, making sure the equipment is suitable for athletes to use it for their protection, making sure they have the right kind of equipment, making sure the equipment fits correctly, making sure that when they get injured, we go out to the field. So in an injury situation, let's take football, right? I've got a football player. He has he's an injury on the field. I go out to the field when he's laying on the field. I make a quick field evaluation of that athlete on the field. Then I help that athlete off the field, carry him off the field, or allow him to stay on. But usually in football, they have to come out for a play at least. I'll pull him off the field. Maybe I'll finish my evaluation on the sideline, and then I'll come up with kind of a in the field diagnosis of what I think's going on. After that, I say, okay, we can tape you up, we can tape your ankle, we can wrap you up, we can keep you out of the game, we can ice your ankle, you know, then I decide what medical care I want to give to the athlete or need to give the athlete. Or maybe I decide this athlete's got a serious issue, I need to send this athlete to the hospital, and then expand my care circle to my physicians and get my physicians involved. And then that athlete gets imagery that provides an actual diagnosis. Then that athlete comes back to me and I begin the rehab to get that athlete back on the field, back to the sport. That's athletic training. That's what that's a big part of what we do. And you'll see there's strength and conditioning. There's a bit of that in there in the rehabilitation portion of strengthening the athlete after the injury to put the athlete back into play. Yes, there's a little bit of strength and conditioning that can lend itself to athletic training, but that's about it. Athletic training and strength and conditioning have their two separate things. Medical care is athletic training, and strength and conditioning is working with athletes and their performance. I did produce an article and put it on my Facebook, I think, that said that athletic trainers, their diagnosis were 94% accurately on par with what doctors come up with for diagnosis. So we're pretty accurate and pretty effective as well.
Nice, nice. As far as level of education for athletic trainers, you don't need a master's or anything to. Oh, you do need it. Okay.
Entry level for athletic trainers is a master's degree.
Master's degree. Okay.
You are
okay.
practicing medicine. We are nationally boarded and certified. You are practicing medicine in a sports environment. Yes.
Makes sense. Makes sense. Good stuff, man. Thank you for clearing that up for me. Good information too as well. What are some of the latest advancements in medical science that are transforming the world of athletic training that you know of? Anything that's new?
So I have some favorite things that are not really new that I've learned since attending the Doctorate of Athletic Training program at the University of Idaho. But I would say what's newer in science that's really piqued my interest. I have a big interest in dry needling, which is not really new. I have a big interest in cold laser treatments and therapies. And then I also have an interest in prolonged ultrasound. Something we've been using a long time is ultrasound, but there's a company that's got a prolonged use of ultrasound that's actually been shown to stimulate new cellular growth where the body had stopped cellular growth. And that's actually funded by a military. Military provides that. It's a veteran-owned company, and the military supports that, the research and the science on that. So those are two of the big areas. Reducing inflammation through the lasers and new cell development and growth with ultrasound is two of the really big areas that I think are promising in medicine, that are sports medicine, that are coming up.
Damn, that's really cool, man. Talk more about you said a laser what now?
Yeah,
what is it?
It's a cold laser. So, you know, we you know, you think of lasers as usually hot, and some lasers will burn, right? But this is a cold laser. And we actually have those coming to the clinic within the next week, I think. And so what it does is I'll give you an interest. I have 3 of them coming. One of them scans. So let's say I've got an elbow issue, right in the middle of my elbow here. And I'm scanning tissue in my forearm or up on my bicep. And as I move that laser over the tissue, it's going to look at density of my tissue. And an injury, the density is different. And so it gets to that injured area and finds maybe more density through scar tissue or swelling. And then the laser, this particular one will stop and do a treatment. And it uses a cold laser to kind of break up that tissue and help with some swelling in that area too. So it's really high-end science and tech, but really does well. Really does well.
It's awesome. It sounds like a oxymoron to me. A cold laser.
Yeah.
Lasers are usually hot, usually. But in this case, it's a cold laser.
It
That's
is.
different.
It is. Anyone that's suffering from an injury, I know that you participate in sports yourself. You and your brother are both what I consider probably pretty high level athletes. You guys are strong. You guys are good. You guys are effective in your sports. If you got some things that are bothering you, stop on by and let me give you a treatment on one of those. And you can begin to understand and see the treatment effect. It is actually cold. It doesn't burn or hurt at all.
That is really cool, and I'm definitely going to take you up on that, sir.
I
Definitely.
know you will.
Because I need it, man. I need it.
Yeah.
I freaking need whatever I can get. What do you think? Do you think there'll eventually be a machine that will make massage therapists obsolete? Something like what you just mentioned?
I don't. Um, you know, there is an aspect to treatment that you cannot get from a machine, and that's human touch, right? I don't care how good the machine is, the touch of another human that's providing a therapy for you can be so beneficial, or a treatment can be so beneficial. Human touch can never be replaced. A machine will never be able to do that. I pray over my hands before I touch every patient, right? Because I want to be effective. I have good intentions for my patient. And just a comforting touch as I talk to and work with my patient, a gentle, we're going to do this, we're going to do that. And often it'll be on the uninjured side to get the patient ready and understand what I'm going to do to the injured side. But that human touch, that affection that comes from a human touch, a machine will never be able to reproduce or replicate. So no, I don't think so, to answer your question.
That is interesting, and I agree. I do agree with you. But it's not stopping humankind for trying to replace, maybe not replace their massage therapists, but I know you've seen the surgery machines
Sure.
that are being developed, where a doctor can perform surgery halfway across the
Yeah.
world, precise surgery with the machine, and I think that's really cool. That's really cool.
Absolutely.
What do you think about that?
I think that that's really cool. And just like traditional medicine, traditional Eastern medicine, and even traditional Western medicine, it has its time and place, right? If a specialist, if the best doctor in the world to perform this particular surgery is halfway across the world and can't get to a patient that needs that surgery over here, then that's a fantastic option to have, right? Um, Speaking from, because I'm a retired soldier, speaking from the battlefield, I've been in units where we do surgery like we're in the battlefield. We're with a forward unit, and when they come in, they need surgery, right? And if we can do that from somewhere else, rather than send a doctor who has a skill that's worth bajillions of dollars, and let alone he can help so many lives which are priceless, rather than putting that specialist in danger of a combat zone, let him do the surgery from there via robotics in theater somewhere. So I think there's a time and a place for it. I think that it does have its place in medicine, but it cannot replace human touch.
Right, right. And yeah, it's amazing concept, and even the ultrasounds, the cold laser, all this is great, but it's important to get to a point that there's something unique about being made in the image of God, that
Right.
nothing that we can do is going to ever, nothing that we can build in our own will ever replace it, and that's what's really awesome
Yeah.
about it. But at the same time, it's God provided us with a mind to use to create machines to make the world a better place too at the same time. So it's like we got the best of both worlds. There are certain things that only we can do, but there are things that we can invent that can enhance what we already can do.
Right.
You know what I mean? So it's really, really awesome. So I want to talk about a little bit about insurance and pharmaceutical companies. You told me a funny story the last time I saw you, and I want you to if you remember, tell that story again to the viewers about, I think you had what was a altercation, so to speak, with an insurance provider or a
Yeah,
pharmaceutical.
yeah. I started my clinic as a cash clinic only, and right now we're really trying to push to see veterans because I want to take care of my own, being a veteran myself. Um, and I was actually having a conversation with one of the insurance companies about the treatments and the treatment paradigms that I use and how effective they are. And the insurance company really barked back at me saying, "Oh, that's voodoo, or that's hogwash, or those techniques are not well supported." And I kind of laughed because I was like, well, is your product well supported for actually getting to the root cause of my patient's problem? Because I can produce data from the treatment paradigms that I use from the times that they were born, the paradigms were born, up all the way until this year. There's recent data and research that factually shows that it works, that it has a place in practice. Uh, and we just went back and forth, and the insurance company was just really trying to discredit the use of anything else other than what they get paid off of, which, you know, a lot of that has to do with the pharmaceutical companies and so on and so forth, which I have a very strong opinion about. I guess we'll get into that a little bit later.
Yes.
But yeah, that was the story. They really tried to argue with how I treat the patient, and it just didn't make sense because the bottom line is who's the complaint, the patient, and I collect my outcome measurements, like how effective my treatment is, the outcome of my treatment. I rely on my patients to tell me, yes, that works, no, that doesn't. And there's a clinical measurement that I use that is accepted in the world of clinicians. It says in clinical medicine, it says, yes, that was clinically effective for your patient. And I use those outcome measurements, not my own. I use the patient's data, the subjective data provided by my patient, to say that this was an effective treatment. And then go ask my patients, and they're all like, "Man, my life is way better. I'm getting it now." So yeah, I don't deal with that insurance company anymore. We'll say that.
And they essentially rebutted with you because they were going to lose out on money at the end of the day. You were doing something that was, correct me if I'm wrong though, but you were going through this path, so to speak, with your client, and the outcome obviously was great, but it wasn't the exact way the insurance company wanted you to do it. And then on top of that, at the end, they want their end game wouldn't have been as high as they wanted. They wouldn't have made as much money as if we would have did it their way. Is that a good way to look at it, or is it deeper than that?
I think a lot of the system is built on recurring patients and repetitive visits and making money rather than treating the patient. So, yeah, because when I'm finished with a patient, um, typically the full process, my patients are better. We address the root cause of the problem, not treat the symptom of the problem. Um, we do also treat the symptoms, and the primary symptom that people report for is pain, right? And so we do absolutely treat that as well. But I don't just throw medicine at it. You know, throwing medicine at everything that walks in the door. Yeah, we might help you with your pain, but what does that medicine do? What other conditions or problems is that medicine creating? Now, don't get me wrong, there's a time and a place for medicine as well, but there are side effects to almost every medicine out there. I can't think of one that doesn't have at least one side effect. Um, and I would rather not go that route first. Let's apply, because the body is an amazing machine. We still haven't figured it out, right? I think we know a lot about the body, but we know less about the body. You know, everyone thinks we don't know what's in our oceans. We really don't know what's in our oceans or what's in deep outer space. We know less about the body too, because there are trillions of organisms inside the body, bacteria, and so on and so forth. We don't. we think we know. We have a nice saying that came about in our doctorate program: as the island of your knowledge grows, so do the shores of your ignorance. And I think if we keep that humble thought in mind while practicing medicine, that we could get somewhere. But I think the majority of it's scaled behind keeping you as a patient, keeping you feeding the system, and paying someone's pocket. That's my personal opinion.
Do you believe that there are cures for most diseases out there, if not pretty much all of them? And the reason why the vaccine or the cure, so to speak, isn't publicly available is because of money. Like HIV, for example. I want you to look this up too when you get time. I think I saw somewhere that there's actually a patent for the cure for HIV, and it's a patent. It's an absolute documented patent out there where there is some sort of cure or something out there for that, and it's obviously not publicly known. But do you think that most of these cures are out there, but they're held in check, so to speak, because Big Pharma wants to keep these patients sick and rolling in money all the time?
You know, I don't know. Do I think that there's some truth to that? My personal belief is that there probably is. But I know that medicine, we call medicine a practice because it's ever evolving, right? Two patients could have the exact same thing but present differently and have different signs and symptoms. So medicine is always changing, and for something that's a virus or a bacteria, like HIV is a virus, the viruses can evolve and they can grow and they can change. COVID is an excellent example of that. We had a shot for one of the COVIDs, but then we had all these other strains that came out, and was the shot effective for those strains? Well, COVID-19, that's the 19th version. There are different COVIDs that are out there. The H1N1, I believe, was a COVID virus, right? There are different ones out there. So as viruses evolve, a cure that you found for one strand of a virus might be effective. It may or may not be effective for an evolved version of the virus. So could it be out there? Sure, it's possible. Is it? Sure, it's possible. Is it the be all and end all of HIV, as you mentioned? Probably not, because just like we do in life, viruses evolve as well.
That makes a lot of sense. That makes a lot of sense. Well, this wasn't on my list of questions, but I did want to, since we're talking about it, I want to ask you this. So, like back when the COVID thing was going on and they were saying, get this vaccine, get the second shot, and then get a booster or whatever. And as you just said, the virus has been here, and it's pretty much probably going to always be here, and it's going to always mutate or change over time. So the only way really to be protected from it, from what they're saying, is it to get a vaccine like every year? Like you will have to get a vaccine forever, right? If you actually looking to always be protected from it, right? Or am I missing?
No, I think I understand what you're saying, and yeah, that's what they would have you believe. I think that's the narrative that's pushed now, and if you look at that, it's a copycat of the flu virus. They try to push you to get a flu vaccine every year, get a flu vaccine, and the flu changes every year, and it's a roll of the dice. Sometimes you get a flu vaccine that's not effective, and you catch the flu anyway because the vaccine was for a different strand of flu. So in that sense, yeah, you could be looking at a virus every year, a vaccination every year. But we have to be careful. This is where research and understanding in medicine makes a lot of sense. And I didn't really understand it to this depth until I began my doctoral program. But you have to look at how many people a virus kills. Then vaccines always kill people. They always, through history, every vaccine ever made, people have had allergic reactions. It's killed people too, right? But the numbers are significantly smaller in the people that are affected by the vaccine itself versus getting the actual virus. And so this is America. This is the home of the free because of the brave. And I think that you should have that option of whether or not to take a vaccine. But before you make a decision, and I don't know that the average person does this. I do, being highly educated, especially in the medical field. You need to be informed before you make a decision, and then make a decision after you've informed yourself. Look for the studies. They're published, they're available. Look for the studies and understand what you're making a decision about. And if you don't know, ask somebody. You know me, so you can ask me.
Yeah.
But
Yes.
ask somebody and make an informed decision, So yes, it could lead to yearly vaccinations for the rest of your life until they find something better. Or, no, it could not. It just, but I think that's an American's right to choose.
Um, Good stuff, man. Good stuff. That whole, because the virus, I thought about it because the virus is still out there. People are still getting it, and this goes right into the next topic, I guess, with pharmaceutical companies. Like a pharmaceutical company would necessarily not want this to end. I'm thinking like if I'm Pfizer, so to speak, and COVID-19 breaks out, if I'm in the revenue department of that company, I'm jumping for joy because it's just like, man, we can put this out and we can I looked it up, they made about $50 billion that year. Like 50 billion. That's just one of the company. Johnson & Johnson made around the same amount, so to speak. So like, yeah, they would not want an outbreak. I guess eventually they'll want it to end, but they're not going to really rush too fast to say, okay, your antibodies are good enough. If you had it, your body will develop the natural antibodies to fight it. So no need to take this vaccine or no need to do this. They're going to be incentivized to do the opposite kind of, right? They're going to say like you need to take this vaccine and you need to take that because never mind your antibodies, you need to take this vaccine. So I guess my question to you is, can we really trust pharmaceutical companies in that regard, knowing that they're raking in billions of dollars on people getting sick? Can we really trust fully what they say when it comes to like what medicines and stuff that we need to take? Because they're going to tell us to take it anyway. You see what I'm saying?
I think that there is trust that can be placed in the pharmaceutical industry. Medicines do work. The majority of medicines that people take do have the desired effect, and so medication works. But again, there's a time and a place for it. Again, I have to go back to being an informed consumer. And this is where more of the trust comes from your medical care provider than the pharmaceutical agency, right? Because the pharmaceutical agency, let's take I'm going to not use a trade name, a generic name, acetaminophen. You know what that is?
No, what is that?
That's a pain reliever that begins with a T that you can buy on the counter in the store, right? So we'll take that. Well, that's a pain reliever. It's a very good pain reliever, right? If I have a sore joint and I take that medication, the pain in my joint is most likely going to go away because of the action of that. The pharmaceutical industry is responsible for research, review, and putting out a product that's acceptable for human consumption to be able to do that very thing. And they have done that. So in that aspect, yes, I can trust the pharmaceutical industry. Um, do I think there's other business practices that the industry participates in that's designed around money, regardless of the human body? Yeah, I do. That's a personal opinion of mine. Just of the things that I've seen, the education that I have, the following the certain studies that I follow, including the COVID studies and the Pfizer studies. Yeah, I have developed that opinion. Absolutely.
What are your thoughts on the opioid
Here
crisis?
we go. I think it is completely unnecessary. Uh, I think I mentioned this to you as well. When I
But
was
before you continue, because um, the 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 opioid crisis has killed, I think, millions, bro. Millions of people have been dying from this. Millions. And this has been a crisis that's been going on way before, like forever. Not forever, but for a long time, before COVID. You know, that's the real crisis in my opinion. So, but yeah, I want you to elaborate more about the opioid crisis and just tell me your overall thoughts on possibly how to fix it and and who started this? Who started the opioid crisis?
well, who started it? I really can't pin it down to a person or a particular organization that started it, but I think the pharmaceutical industry has a very large responsibility in it. I think the doctors have, certain doctors have, and the healthcare system as a whole has a responsibility um, for creating the opioid crisis. The crisis is unnecessary, was unnecessary, and now that we are here, I think there are ways around it. My personal opinion again is that the money's so good with them, with the opioids, that they just continue to take the risk and affect people's lives. In school, during my master's in athletic training, one of the physicians that was an associate professor brought a study. This study was Tylenol. I said it. I was trying not to say it. Was Tylenol and Motrin mixed. So acetaminophen and ibuprofen mixed together. Had the same pain effective relief as some of your bigger drugs like Percocet and Darvocet and things like that. Those opioids, it had the same effectiveness on pain as those two. And I asked the physician, I said, because I had a history already in the military being a nurse, I said, wait a minute, if we have such an opioid crisis in the country and you guys know you can get effective pain relief from these two medications that are combined, why are you still prescribing opioids? And the doctor blew me away, man. She was like, it's what we've always done. What? Really? So I think we could be making more of an effort to fixing it. But it's a real sore subject for me because as a medical care provider myself, I want to help people. My goal is helping people. My spiritual purpose in life is healing and helping people to reach. And when we're creating problems for a momentary relief of pain and there's a better way to do it, I got a problem with it. I got a problem with it. It really, really digs at me.
I I just looked it up. According to the CDC, uh, nearly 500,000 people died from an overdose involving opioids in the United States from 1999 to 2019. So 500,000 people from that time frame. And it said in 2019 alone, 50,000 people died in related opioid overdose deaths.
Unacceptable, man. Unacceptable. Unacceptable. As an athletic trainer, I have certain paradigms I use to treat pain that don't involve medication. Unacceptable. For what? A couple of dollars?
Couple of those. Yeah.
Unacceptable.
Yeah. That's staggering right there. That's staggering. That is, I don't know. My math could be way off, but that's like 20 people a day or something like that. Like that is ridiculous. And that's just in the United States. It's getting down in, Canada and, and lower parts of Latin America too. So it's probably well over 1 million if you include those two countries as well. So yeah, man, that's really, really sad. And the root cause of that mainly is money, right? Because there are cheaper ways or other ways that are just as effective. Like you said, you got this the T word. Well, we already said Tylenol. We got them,
Yeah.
and and
Ibuprofen.
I like what you said. That the ingredients of that medicine works the same as these other prescribed. So, but I believe they know this, man. They know this already.
They do.
But they're not going to change without a fight. So interesting stuff. Yeah, I had a few more. How does direct to customer advertising by these pharmaceutical companies influence public health? Like, how you see the commercials, take this pill, take that pill. How do you think that's playing a role in medicine these days?
I think that it's very persuasive. Unfortunately, finding a way to advertising and reach a target audience has come down to a science, and they're very good at it, right? And so they want to advertise to a certain target audience. They figure out how to get to whatever's going to motivate that target audience most. And that's part of the advertisement. So, if I am struggling with depression, let's say, and I'm watching television and I've found nothing. My care providers have not been successful in helping me. The medications that I've been prescribed, they kind of work. At a certain point, I become desperate for some help, for something that's going to work. And then that direct to customer advertisement, oh, maybe this will work. Well, they make this look really, really good. And it hits me in a motivational piece up here and here. And then I feel it in my body. And I'm like, maybe that's the one that's going to work for me. So and then I go ask my doctor, because what do they say in the commercials? Ask your doctor about so. Right. And so then I go ask my doctor. So I think that's very effective, but I think that it's meant to draw you in to their product. We don't know if that product works for you or not for you, but it is a discussion that you should have with your care provider. But that direct to customer advertising for people that for that target audience that's watching it, it's very effective. And I think that it can be it can add to the detriment of the use of medication.
Yeah. When I went to the doctor one time a while ago, I was experiencing cluster headaches, like these really, really terrible headaches.
Mm-hmm.
And I went to the doctor and I told him what I had going on. The first thing, if I remember correctly, the first thing he asked me was I depressed? And I was like, well, sometimes, I get down or whatever, but I wouldn't say I'm depressed. But then immediately after that, he followed up and said, do you want any antidepressants? I was like,
but I'm not depressed.
Right. I was probably, man, I was like 18. I mean, I wasn't that young, but I was 18, 19, but he just threw it at me. Like, no headache medicine, no nothing. He was just like, do you want antidepressants? I just found that was so strange, man. I never forgot that. That was years ago, but he threw it at me.
I recently had a disagreement with my very care, because I run high A1C. That's one of the measurements of diabetes. And my A1C was high at one doctor visit, and so they were like, well, you're pre-diabetic. And I said, no, I'm not. I run a high A1C, I eat a lot. And they prescribed me a diabetic medication. And I asked, why are you prescribing me this? I'm not going to take this. We'll just keep it anyway, just in case. I ended up taking it to one of the pill returns and dumping it in the box. And I said, why would I take that? Medically, you need 2 clinical markers to say that I'm diabetic, and you should have that on 2 separate visits. If I had a high A1C on one visit, you schedule me for another visit 90 days out, and you check my A1C again, but you also check my fasting blood glucose, how much sugar stays in my bloodstream after I haven't eaten for a while. The funny part was I had drank a protein shake after the workout right before I went to have my labs drawn, and my sugar was still under the level. And I said, you don't have 2 clinical markers, and you haven't done your work to say that I have diabetes. But the first thing you did was throw pills at me, and it really discredited my provider to me. Like, I can't trust the words you say. I would rather take my own health and look up my own stuff. And I do a lot for my wife, other members of my family. They consult me sometimes for their things, and I it just I don't trust it. Just throwing that medication, just like they did you, throwing that medication at me. That's not the answer. That's not the answer. We can work with the human body and get fantastic results, often avoiding medication altogether.
Right, right. Yeah, man. I want you to explain this to me real quick, and we got a few more minutes left.
Okay.
Um, how does what is the chain of command between the doctors and the pharmaceutical companies? How do the doctors do they get a cut from the prescriptions? Like, is there a contract between them? So how do the doctors get compensated, so to speak, by prescribing you medicine?
Not having seen this firsthand, I can only share with you my understanding of the ways the system works. I have in the past been working in a hospital, seen pharmaceutical reps come to the hospital, pitch their pitch for their medication. The hospital decides whether or not they're going to keep that on the formulary or bring that into their formulary and make that one of their prescriptions. I have heard, I have not seen, I've never seen money change hands, but from some pretty solid sources, I have heard that the hospitals and or the doctors can receive compensation in some way, shape, or form for prescribing medications. So, do I believe it exists? Absolutely, 100% positive that it does. But have I seen that process thoroughly make its way through? No, I have not. But it looks like it is. If it walks like a duck, talks like wiggles like a duck, man.
Right,
So
right,
it does.
right.
It does appear that is the way that things happen. And look at a pharmaceutical rep's salary. They're paid very handsomely to go and do what they do, and they sell drugs. They legally sell drugs. So
They legally sell drugs. Yes, yes. So, but yeah, pretty much it probably goes on. It'd be interesting to look at the specific things that goes on, like how payers have a contract with providers. So they're going to try to push patients, clients to providers in network so they can get a cut of that. So I would imagine it's probably something similar with doctors prescribing medicine. Maybe. Maybe.
I watched something in the military with a medicine that begins with a Z for moods and depression. Watched a non-invasive electric stem where they put these little things on your ear and give you these little shocks. I actually have a machine, and that was so effective for helping soldiers, and myself included. I was treated with this. Like I said, I have a machine here at my house. So effective at treating soldiers, yet a drug company came in and somehow got into the formulary, and they stopped prescribing that and they call it EMDR. They stopped prescribing it to soldiers. When I came back from Afghanistan, it helped me deal with PTSD. And my family who is watching, I do want to take this second. I see all my family on there, and I love you, but my son from all the way from Japan is tuned in right now. I love you, son. I'm glad to see you on.
Hey,
but,
shout shout out to him, man. Give me a follow. What's his name?
Eddie Hogan.
Eddie. Hey, give me a follow, Eddie. but go ahead, Jay.
When I came back, and I retired just after a deployment, and I had some issues. My wife, my family knows a little bit about it, but I don't share it all. I'm not a big share all my issues out there, but I used that therapy and some other therapies that I had gotten that were non-medication prescribing therapies and treatments, and I treated myself, and I'm actually much better, much better. When the fireworks go off at the soccer stadium, I'm not freaking out. My wife doesn't look across the room to make sure that I'm not going to have a reaction, right? So it was effective, but it was gone away from in use of a medication instead. And I was really disappointed to see the military, of all things, do that, but they did it.
Wow, man. Wow. Crazy world we live in. Seems like money is the root cause. Like the Bible says, the love of money is the root of all evil. So all this is really, really ultimately about money when it comes down to these practices. But thank you, man, for joining me. I did want to ask you another thing, though. Any question you have for me before we end the show today?
Yeah, when am I gonna see you?
I need to come see you, man. For those who don't know, I had a brutal surgery. What's it called, man? Fasciotomy, which is really, really nasty surgery, and I'm trying to bounce back from that. So, yeah, I did what you. I'm going to do what you told me to do to finish with the physical therapy.
Absolutely.
Get discharged from them, and then I can move over and work with you. So that seemed like a pretty good idea.
Absolutely. No,
man.
No other questions, man. I think it's fantastic what you do, and I'm going to subscribe. I haven't yet, and I apologize for that, but you got me now. I see the Webbers, my other family's on there. I see your brothers on there. Hill Boogie's on there. A few people I know on there, and I'm going to share it as well. So we'll get you pumped up. I like this, man. I like it. Good question, too. Very good questions.
Thank you, man. I've been doing it for a couple of years now. Hopefully soon it'll really take off, man, and make an impact on people and provide them with valuable information from wonderful guests like you who are knowledgeable in their fields and just, can give out good information and good stuff to the people, man. So thank you, man. And real quick, shout out your Instagram. I don't know if you have a YouTube channel where people can find you and get in contact with you.
Yeah, the YouTube and Facebook. Look, I don't even do it. My wife does it. I don't even do it.
Shout out to the niece.
Yeah, big time. Everything's under Work Time Athletic Performance. You'll see a red, black, and white logo with a W and a T. That's the Instagram. That's the YouTube channel, which is mostly private videos that I send to other people. But we're going to start producing content there as well. But it's all under Work Time Athletic Performance. If you just type that in any of the search bars in the social medias, we should come up. Should be a circle with a W and a T in the middle.
Awesome, man. Jay, man, thank you so much for joining me. All your information was valuable. I have to definitely bring you on again to dive more into this, to the pharmaceutical thing, and it's a whole lot of things to talk about. But I appreciate you for staying with me and talking with me today. Thank you, man.
It was a pleasure, man. It was a pleasure. Thank you.
If you're watching this on YouTube, please consider to give this a like and follow and subscribe. Hit up Jay if you need anything. He'll take care of you. Jay, man, you have a great rest of your afternoon, man. Say hi to your family.
Be blessed. Everybody watching, be blessed.
Thank you. Peace, man. Peace.